Hello everyone, welcome back to my channel. Today we are going to learn about antiarrhythmic agents. In this video we discuss in detail about definition, classification and mechanism of action. Let's begin with the definition. Delete. Antiarrhythmic agents are drugs used to prevent, treat, or suppress abnormal heart rhythms by modifying electrical conduction in cardiac tissues. Now, about the classification of antiarrhythmic agents. These classification, which are based on von Williams classification. First class is a class 1 drug which is a sodium channel blockers. Examples are quinidine, lidocaine. Second, class second drugs which is a beta blockers. Examples are propranolol, metoprolol. Third one is class third drugs which is a potassium channel blockers. Example amiodarone, sotalol. Class 4 are calcium channel blockers. Examples are verapamil, diltiazem and other drugs like digoxin and adenosine. So all these are the different classes of antiarrhythmic agents. Moving with the next slide, which is about cardiac action potential. This here, this diagram which shows the different phases of cardiac action potential. And this cardiac action potential describes the electrical changes that occurs in heart muscles to cell to heart muscles cells to trigger contraction. So here there is a phase 0. This phase 0 which having a rapid depolarization means here in this phase 0 there is a sudden influx of sodium ion occurs through voltage gated sodium channel, and because of this the cell membrane potential which rapidly becomes more positive. It goes from minus 90 millivolt to plus 20 millivolts. After that there is a phase 1. This phase 1 which is nothing but the initial repolarization means here the sodium channel close quickly and potassium ion starts to leave the cell through transient outward potassium channel, and because of this there is a slight drop in membrane potential and a small downward notch after initial spike will occur because of the outward movement of potassium. After that there is a phase 2. This phase 2 which is a plateau phase. In this the calcium ions enter cell through L-type calcium channels while potassium ions which are continue to leave, and this influx of positive calcium balances the potassium efflux, and because of this plateau keeps the membrane potential relatively stable, prolonging the action potential and allowing sufficient time for the heart muscles to contract and pump blood efficiently. After that there is a phase 3. This phase 3 which is a rapid depolarization. In that this is because the calcium channel get closed and potassium channel remains open, and potassium leaves the cell in large amount, and this causes the membrane potential to return back to the resting negative value. Next is a phase 4 which is a resting membrane potential, and the cell returns to its resting state. So which is towards the minus 90 millivolt. So these are about the cardiac action potential and the different phases. Now here there are a different antiarrhythmic agent which acts on these phases, like class 1 drugs which block the phase 0 means these are all all these are a sodium channel blockers. Class 2 drugs which reduce the slope of phase 4, and the beta blockers means class 2 drugs which act on these. Whereas class 3 drugs which act as a act on phase 3 and which are a potassium blockers, whereas class 4 drugs which act on phase 2 and AV node and which are all a calcium blockers. So here about in short the different class of drug and in which phase they will act. Now in detail we discuss one by one. So the mechanism of action of class 1 drugs, which is all are sodium channel blockers. So these block the fast sodium channel in phase 0 depolarization. They reduce excitability and conduction velocity. There are a subtype of this class 1 which are class 1A, example quinidine, which moderately block prolonged depolarization, whereas second subtype is class 1B, example lidocaine, which is a weak block and shorten repolarization will produce, whereas subtype is a class 1C, example flecainide, which is a strong blocker which having a minimal effect on repolarization. Now moving to the mechanism of action of class 2, which are nothing but the beta blockers. So these block the beta adrenergic receptor, which decrease heart rate, contractility, and AV conduction, and suppress the abnormal pacemaker activity. Now, next is about the examples propranolol, metoprolol. Now about class 3 mechanism of action, which are a potassium channel blockers. So which block the potassium efflux during repolarization, that is in phase 3, which prolong action potential duration and refractory period, which prevent re-entry arrhythmias. Examples are amiodarone and sotalol. Next is a class 4 mechanism of action. So all these are a calcium channel blockers. These blocks the L-type calcium channel and which slow conduction in SA and AV node, which reduces heart rate and contractility. Examples are verapamil, diltiazem. So there are other antiarrhythmic agents like adenosine, which activates potassium current, hyperpolarized cells, slows AV conduction. Next is the digoxin, which increases vagal tone and decreases AV node conduction. So this simplified flowchart of antiarrhythmic drug action, in short, you will get that which class, what is the which type of drugs and what it will do. Like class 1 antiarrhythmic drugs which block the sodium channel and decrease conduction. Class 2 which blocks beta receptor, decrease heart rate and AV conduction. Class 3 which are a block potassium channel, increase refractory period, whereas class 4 which block the calcium channel and decrease AV node conduction. Other drugs like adenosine, digoxin, which are having a special actions on AV node. So here we discuss in detail about the antiarrhythmic agent. I hope this video helps you to understand the topic better. If you found it useful, don't forget to like, share and subscribe to my channel for more educational content. Thank you and happy learning.